more women around here.
I know, Cody Ware.
Wow.
That's awesome.
You better watch it.
We're
I'm
outnumbered.
excited.
Yeah. You're outnumbered now.
Why don't you sit here?
Oh, I think this chair finally said, Cody,
We're gonna have to do money.
your
Is it
fat ass
time?
has been in here long enough.
It's time.
I'm done.
You can't do it anymore.
And I can come up.
Well, actually, it was my chair. I just switched it for yours.
Was it really?
No.
Rick will remember in our old meeting room down on the first floor before the remodel, we had old chairs in there, and there was one that, yes, you would sit down and you would go. And I mean, I thought I lost my life several times. And it was musical chairs. When people would get in there, they would
It's
scoot
like
that chair
roulette.
around.
You never
and
know
sit.
which person has
Yeah.
it.
Yeah, sit on the edge,
Yeah.
not to fall back.
Well, it'll just keep you from sleeping on the job, right?
Yeah, on pins
Felt
and
like you were
needles.
falling through space.
And I did not break that chair.
I wouldn't have said you would.
I'm just, you know,
Probably mine.
I've
clearing
never
up,
thought
clearing
that.
up the assumptions. Huh?
Was probably mine, I'll say.
No, it was like that.
Me too.
All right, it is 1 o'clock. Go ahead and call this meeting to order. This is a regular BET meeting of February the 7th. This meeting was properly posted on Monday, February 6th. Just for the record, the sheriff's office is not a voting member today. Mr. Holmes could not be here, and they do not have Andrea set up yet as a member, but I invited her up here so she can partake in all the discussions, just any of the votes. And I'm saying this just so the clerk's office is clear. There won't be a vote for the sheriff's office. So, anyway. All right, item number 1, discussion possible action regarding the minutes of the regular meeting on Tuesday, January 10th.
I'll move the meeting. I'll move the minutes posted for January the 10th.
Second.
Okay, we've got a motion and a second to approve the minutes from the January 10th meeting. All those in favor say aye.
Aye.
Aye. Any opposed? Ayes have it. Item number 2, discussion and possible action regarding an update on employee benefits. Mr. Wilkerson.
Good afternoon. I have a revised attachment or a revised spreadsheet compared to the one that was on the agenda. I just had a couple numbers that needed to be changed.
Let's get a,
Yeah, sorry.
you said this one is not attached to the agenda?
No, it's an updated one.
Let's go ahead and get a motion to receive the updated document, please.
Motion to receive?
Second.
And a motion and a second to receive the document. All those in favor say aye. Aye. Any opposed? Ayes have it. John, I think we need another one.
Sure.
Thank you.
I need one.
Yeah, we just had a couple numbers flipped on the original one, but this is the updated one. Overall, we're a little up compared to where we were last year at this time. Really, the money's coming in or the reimbursements coming in is a big difference. I look back on medical this year compared to last fiscal year, and really we've carried forward an invoice from last fiscal year into this fiscal year for medical. So we're really way lower than that if we're really doing true apples to apples comparison. Prescriptions are about right on line.
John, before you get any further, I
Sure.
just want to verify though, the previous year, did we not roll over one from the previous year as
did.
well?
I checked
Because that happens occasionally.
I checked it.
Okay, I just want to make sure we're comparing
Yeah,
apples to
absolutely.
apples.
I checked that before the meeting. So
Okay.
I just kind of dug deeper into it to see actually where we were. So if we look at those, we're really about 3% apples to apples on medical. So not too bad. Prescriptions, we're really seeing the impact, especially drugs are on the rise. You see all the commercials. We have high utilization of those. The good news is we get big rebates back. So every 3 months we get a rebate check every quarter. And that usually covers 1 month of prescription costs. So we pay for 12 months and we get about 4 months back of rebates. So if you look down here, the money that we received back this year, this is really where the big difference is along with that, is we received less stop loss reimbursements, less prescription rebates, and then again, the COVID money less on that. So overall, we're up compared to where we were at last year.
Well, and on some of these, if the COVID reimbursement is less than the previous year, that also means that the expenses above are less.
No, not necessarily, because more people go to the doctor for a flu, or more people go have cancer treatment, all that stuff. So it's not directly related.
Well, no, that's my point.
Yeah.
though. If we would have had more COVID-related reimbursements, we would have had more COVID-related expenses, so our expenses would have been higher. I think sometimes we get a little bogged down in looking at the reimbursements versus the top area that are our actual expenses, because these reimbursements come in at different times of the year. So I think it gives us a false sense of security sometimes that we're in a really good spot, but then, you know, the next month, maybe we don't get a rebate the next month that we got the year before in March, for instance, right?
That makes sense, yeah.
So I know, what was it, about 5 years ago, we switched our prescriptions to that other network, so we started getting larger rebates, correct?
Right, yeah. So if you look back, 17, 18, we had a huge year, huge medical year and prescription year. It just, that happens in self-insured. And after that, the last 5 fiscal years on a net basis, we've trickled down. But we changed the prescriptions to help us since then. Before, we were getting about $386,000 a year in prescription rebates. We're about set to get about $4 million this fiscal year.
Okay, well, I bring that up to ask, over the last several years, have our rebates been fairly consistent annually?
They're going up every year based on consumption. So they're based on consumption. As members get prescriptions, they get the more costly prescriptions. They utilize more services, the rebates go up because we spend more money. Does that make sense?
Well, yeah, sure, but I think when we're looking at these on a month-to-month basis to see where we are on our plan, and when we're weighing heavily some of these rebates, one month it looks like, man, we're rocking solid because we got a rebate this month, but last year we got the rebate a month later, so then we're hit with sticker shock like some probably were. I mean, I know I was when I pulled this up. And really, if you look at our total medical and prescription spend, last month when we had our meeting, that was 15.8% over the previous year. So we're actually in better shape this month than we were last month on the actual spend. Is that correct, John?
Yeah.
But because of the wonkiness of our rebates when we get them and when we don't get them, it causes this. I think last month we had a very optimistic because of when those rebates hit, right?
Yeah.
And it wasn't a true accurate depiction of what the final picture was going to be. So these things are kind of skewing us. So if you can kind of think of a way to keep us a little more even keel on, hey, this month it looks really good, but last year the rebate that we got this month, we actually got it the next month. So let's kind of keep that in mind.
Yeah,
Are you following what I'm
I
saying?
am following what you're saying, absolutely. Kind of predictive forecast. This happened this last month this year, but now we expect it maybe be the next month, and we might have a gap. But looking forward though to where we're at now, kind of, and claims trickling in, we do see medical coming down, which is good. Our most recent check register for medical was about $251,000 compared to $400-some-thousand ones we've been receiving. So those are kind of trickling down. We have one last one in February, will be this Thursday, that'll be considered February. So trying to be optimistic on that, guessing about $300,000 on that. That's kind of where we're at now.
Yeah. Well, and I just want to be clear on these numbers, whether they're high or low, it's not an indictment on you. I mean, you're managing it as well as you can. You come up with some great innovative tools. We just need you to give us the actual numbers. We know you're not the one deciding whether to admit somebody into a hospital or whether they're going to get this prescription or that prescription. You have nothing to do with those utilization numbers at all. We just need, excuse me, that information communicated
To budget. So forecasting out, what I do know is next month we'll receive about $1 million rebate check expected on March 8th. So this prior month we allocated money early from deposits, And we did that prescription rebate check too to cover kind of the overage that we had. So next month we should receive another prescription rebate check and help us get back into where we should be. And I'll talk about some other stuff too.
Okay.
Next item.
Does anybody else have any questions about this? I have one more, but it's a little specific. It's not just related to the numbers. So does anybody else have anything on this? My question I wanted to bring up to you, John. We've got some great benefits. Our 100% benefits program that's out there is unbelievable. The stuff that our employees have access to is incredible. One of them being Rebus. I mean, that was huge. The ability for our employees to get that type of health care covered at 100% is incredible. I have been getting, over the last few months, numerous employees calling and, asking me about, this and that with Rebus. And I just want to ask you, so do you know what our employee utilization is?
Yeah, it's high. I wish, like, when people call you, they'd call me because I manage the benefits.
Yeah.
If I don't know something's a problem, I can't do anything about it.
Well, and it's usually not a phone call. It's in the hallway. Hey, my kid had this situation and my wife had that and whatever. And it's mostly the getting in to be seen.
Yeah.
Phone calls not being returned in a timely manner, 6 weeks out on appointments, that kind of stuff. And on mental health, I mean, especially when we're dealing with, high anxiety and stress and that kind of stuff, if folks aren't getting phone calls back in a timely manner to set appointments, and then they know, oh, I really need to get in and see this provider, and then I can't for 6 weeks, and then it gets to be a little escalating effect. So if you could kind of look at some of our utilization numbers and what kind of, if they're tracking on time frames.
Yeah, I deal with that on a daily basis, actually.
Okay.
And deal with employees, retirees, dependents, to get them in Rebus, to get them in the different clinics. That's part of our job that we do every day.
Yeah.
And we deal with that every day.
Okay. Well, I know it's an issue because I've heard it from several employees.
Yeah. So when you hear that, ask them to call me, so we can actually deal with the issue and see if theirs is separate from someone else's issue, or if there's, because we're glad to help with
Hey, listen, I've reached out to you on other things in the past, and you guys do a great job. I think what's happening is some have reached out, and you reach out. We know you do what you can, but they don't get the result necessarily from that provider, and so they just think, well, it is what it is, and it's just not going to be able to be fixed.
No, I understand that.
It's nothing on you
No, I
because
understand that.
you jump through hoops for all of our employees, and I can't say how much of a benefit that me and my family personally have had over the years with some of the stuff, and you have helped, and I cannot express enough how well you guys do. But I think our provider here maybe is, I think they might be a little overwhelmed or something. I don't know what the deal is, but I just wanted to.
I appreciate you bringing that up,
To bring
because I do deal with those every day too. So issues like that. So anytime anybody has any complaints or issues, please send them to me, because I like to address it up front and see, is this something specific to this person or their case, or is this something specific to everybody who's trying to seek treatment? But I know that it takes about a week for the initial intake at Rebus, usually, and then it's a week to get it into a provider. So we're trying to, look at that.
If you would look at it and let me know, some of our utilization and, just some of the numbers, with their callback, if they have a callback policy and what their, the amount of time it is to get in as a new patient, but also scheduling, appointments out for.
I will, for sure.
Patients.
For sure, because right now I know, because I'm dealing with that, it's about initial patient that needs meds. It's about a week to get set up with a nurse, which is kind of typical in the industry wide. And it should be about a week to get set up with a provider. But we can try to ramp up those times if they're needed.
Okay. Well, I'm hearing 6 weeks.
It should
From two other people today mentioned it to me. That's the only reason why it's fresh on my brain, and that's why I brought it up now.
Yeah.
So
But if I can find out who those people are, we can kind of address them specifically and find out.
Okay.
For sure. But just everybody remember, I'm happy to help and here to help, and issues like that, if we don't know, we can't do anything about it.
Yeah.
So I'm glad you brought that up, and we'll look into Rebus.
okay. Thanks, Joe.
Mm-hmm.
Motion to receive report. Second.
We got a motion and a second. All those in favor say aye.
Aye.
Any opposed? Thanks, John. All right, item 3, discussion possible action regarding any items currently on the DVT watch list. Does anybody have anything? I know, Juvenile reached out to me. She said that she's probably planning on looking at May to come back to us with some updated information. She said she's happy to, put some stuff together earlier if we need it, but she doesn't think it'll be an issue until, at least around the May time. I know we do have $19,000 on the watch list for court services on the GPS damage units. If you recall, in our September supplement, we funded them for the GPS monitors that they already knew were lost and that they were going to have to pay for. And instead of just having them give us an estimate and us funding the estimate for the rest of the year, because they're billed on a calendar year, not a fiscal year, we just put $19,000 on there. That was kind of the estimate. They did get their final bill in. The bill was around $38,000. They wound up having 40 lost GPS bracelets last fiscal year, which is double what it was the previous year. So that is, it is what it is. But anyway, Grain's going to put some numbers together to see exactly how much of that increase he's going to need put into his budget and get back with us probably next month or the month after. But hopefully it can be reeled in this year and we don't have quite as many. But court services, of the 40, they had 4 of them. So court services is doing a good job of getting their bracelets that have been cut off. They're getting them back, but it's some of the other entities that are utilizing the GPS monitors that court services has. That's where the other 36 are coming from. So and it gets a little, they're about $1,050 a piece when they're cut off and not returned. So Grant wanted me to just give that brief update. So does anybody have anything on any of the other items that are currently on the list? All right, if not, we'll move on to item 4. This is an item regarding a potential transfer of general fund reserve dollars, $6,193.50. It's a request to make a recommendation to transfer that to the public defender's general fund account. The issue here was they had some moving expenses when they were moving back from ICB over to the 6th floor. To be able to secure the mover, Bob went ahead and engaged their services. Stacy had agreed to pay for that out of the project, the 6th floor remodel project. But that check, now that the project was finished, Stacy can't just take that money and deposit it into the public defender's general fund account because our general fund budget for this year is set. So there's really 2 choices, which is to just hold the money and then give it to the public defender next fiscal year, but he really needs it this year. So the solution that we've done in the past in these types of situations is go ahead and book that money into general fund and it sits there for allocation at the next budget cycle. But we just transfer money from reserve so they have the money now. So that's what this item is here for.
Bob talked to me about this as well. I'll make a recommendation we'll recommend from the ET to do the $6,193.50 for the public defender.
Okay, we got a motion and a second. Is there any further discussion? If not, all those in favor say aye.
Aye.
Any opposed? Ayes have it. All right, item 5, discussion possible action to move Kelly Thomas, BOCC Administrator, and corresponding funds from 1001260 to 1001920. for the remainder of the fiscal year, effective January 21st, 23, and then it's got the actual amounts on there for the different accounts. This is not something that we usually do, to my recollection. Do you guys?
I just posted this as an extra layer.
Okay.
Yeah,
I mean, do we need to make a recommendation to budget board?
well, it's general fund, so how else? It's in the budget of, the other departments, so.
It's a position that was budgeted
Yeah.
in
Right.
health and safety.
Right,
And
and
then
we're
now
pulling it out of there
Yeah.
into another
to
one.
District 2,
Can we
right?
just do it without budget board?
No, I'm not saying to do it without budget board. It's just, there's lots of things that budget board does that we don't,
Okay,
that we
so
don't
it shouldn't have come
make.
here.
Well, I don't know. I don't recall seeing this. I mean, I don't necessarily, I don't know.
I see your point, like, our committees, we don't say personnel,
Right,
this person's gonna go from here to here, that's not our decision. And maybe just since money was involved,
yeah.
Mhm.
What,
it probably didn't need to. I mean, if there's a level with the BOCC or budget board that's gonna move a position, then money, in my mind, would just go with
With
it.
it.
right.
Okay.
My only issue with this, it's not necessarily this particular one. I'm just uncomfortable about setting a precedent that in the future, everybody's gonna think, well, we can't do this unless BET, we gotta take it there first, you know?
Well, that's fine. It was just an extra layer of caution. So I'll move to strike.
Well, and I could be completely wrong.
I don't think so, because it's not our decision to approve someone moving from one department to another, and that's kind of.
Right, and that was BOCC that made that call. So, okay. Okay, we got a motion to strike. Is there a second?
Second.
All those in favor say aye.
Aye.
Any opposed? Ayes have it. Item 6, discussion possible action regarding a transfer in an amount not to exceed 1.1 million from general fund reserve to employee benefits.
I have one.
This is to cover the cost of February 2022 employee benefit expenses.
Correct. So we have 2 BOCC meetings per month. Each one we pay medical and prescription claims when they come in. We've already used this month's budget up for the first BOCC meeting this month. So we're pending claims, medical and prescription claims, until we get more money in the fund. We do see, like I said, but it's week to week, we see medical claims trending down. With all that being said, with the estimated medical invoice that's going to come in this Thursday, we need about 1.4 million to fund the pending claims. The good news is we have pending deposits. We're going to allocate January deposits early at the February budget board. Hopefully about 370,000. I just filed for January paid COVID claims reimbursement, which is 197,000. So those will bring in 567,000 approximately. So with that being said, with those getting those deposits back, I think we're going to be about $859,000 short to get through February. We could hold everything and just pay them next month. If we do that, holding the prescription claims, we're running into the risk of everyone's cards getting cut off. If we don't pay our prescription claims timely, because they fund our prescriptions up front. So if we don't fund prescription claims, we can push them into next month, but we run the risk of that getting cut off. We have a large check register for medical claims that came in for $408,000. We have one claim on there that we had a $225,000 discount on that claim. We paid $75,000 on it. If we let that claim go too long without being paid, we would have to pay the whole cost of that claim, the whole $300,000 versus a $75,000 claim.
Do you know how long that period would be?
30 days from when we get it.
So if
When did
we
you do
went over the 30 days, then
There's a possibility. And they don't usually do that unless it's a big dollar claim like this. They'll start auditing claims and see when it was paid, when it was received. So that's the risk we run of holding claims. We could kind of run that risk and hold them and pay for them when we get more money next month.
is there a way to mitigate those risks though? For instance, can we call CVS and say, hey, this is the deal, can you not affect our prescription cards we're gonna send a check in on this
No.
date,
No, we can't.
and the provider on the big medical claim, could you contact them and say, we'll have money
We're running so
on?
we're running so close to that date. I would never contact them because then we'll end up owing that amount because we're right there, kind of on that deadline.
Today we are.
Pretty close, you know. By the BOCC meeting this month, it really needs to be paid. So those are the risks. I want to make you aware of the risk. That's why I don't think I came in 4 years to ask for money for employee benefits. So that's the risk we run. I think this one-time cash infusion will get us to next month where hopefully claims trickle down. We'll get another prescription rebate check next month. And then in June, we'll get another one. But this is kind of a situation where we're at now. We're holding probably, about $1.5 million in claims. $859,000 will probably get us past there. We'll have a little infusion next month with our normal deposits at the first of the month, and we'll be there.
So our rebate, does it come from CVS directly? Would CVS, in lieu of sending us $1 million rebate, would they take the $579,000
We don't do that.
off of what we owe?
No.
Should have got to run all the numbers through their system.
Yeah, it's a separate system. So that's why I don't come to this board lightly. I haven't in 13 years I've been here. We need the cash. We need people to be able to use their benefits. Hopefully this is kind of a one-time situation, what I'm hoping for. Looking forward, we're going to get a cash infusion next month and one in June. So if medical claims keep trending down, we should be okay. I'm not saying it could change drastically next month, but being self-insured, that's one of the risks we run. Claims can go up, they can go down. Back in 16, 17, we had a real high claim dollar year. If we were fully insured, we'd be paying 20% on top of that the next year, another 20% would stack up. So we kind of have the ability our costs to go up and go down. So they could trend down too, but that's we need some cash infusion into employee benefits to cover those claims we're holding right now. So at least I pay $859,000 on that handout to get us caught back up. I don't think we made a transfer or BET transfer for years into employee benefits. Most plans our size run with about a $2 million reserve just in case for these rainy days. We've been really lucky.
Well, that's why a lot of us around here in September, we always say our reserve account needs to be $1.5 to $2 million just because of situations like this.
Because we never know. We could have a lot of people get sick all at once, and then next month their claims hit, and it goes up, and kind of like we're doing now. But and it could go down next month too.
Right, and that's the thing though. When we put the money into employee benefits, we can't pull it back out.
So that's
It's-
why
it's
I kind
in
of
there.
that's right. So that's why I kind of you brought up a good point. That's why I didn't overestimate it. Like say, hey, let's go for the 1.1. I know 859 should get us through this month until we get the next infusion in at the first of the month. So I didn't want to ask for too much, if that makes sense, because I know it can't come back out once we put it in there.
We have to pay our bills. I
It's
mean,
a choice
I
to
just
not do
I'm
it.
kind of like looking at what can we do, but it's like it's tough with all utilities, outside legal, still kind of waiting to see if some other bond is going to drop. But
Well, I know I've already said this, but this is the reason why we try to hold at least $1.5 to $2 million in reserve, because we never know when we're going to have to put an infusion of cash in there. My questions aren't whether the money's going to be needed. It's more, are there processes that we could do to, to change things up so that we move things around and we don't have to move money from reserve in there right now? Is there other things that we can do? But it sounds like you vetted all of that, right, John?
Yeah, we vetted all of that, and we're gonna allocate early, like we used to not allocate early, but we're allocating money early at the budget board even this month. We tried that, and we're not getting to that point that we need. It just makes us have to hold claims that we probably don't need to hold, unfortunately.
I'll make a motion that we recommend to budget board to move $860,000 to employees benefits out of reserve.
Second.
Now, John, you said you're estimating 370,000 here. Do you, with the recommendation that we're looking at here, 860,000, that's only giving us a $521 buffer. How solid are you on that estimate of $300,000? Because if that's lower than that, you won't have enough money to meet all of the obligations.
Yeah, so if you approve a transfer and the board does of $860,000, and our claims this week come in above that $300,000 level, then we will have to hold those until the first of next month.
Well, but it's not just that 300,000; it's also the 370,000 that you're estimating coming in, right?
And I think that's pretty
pretty
solid
good.
because we
That's
look
stuff
at
we've
past
already
months.
received.
Yeah.
Like we've probably got it.
Okay.
You
Yeah,
probably-
so I got with
Certain date, but
Micah
yeah.
before, and she said that's a good estimate to put on there, the
Okay.
370. And then I know that I've filed that COVID reimbursement too, so I know that's coming on this.
Okay, I'm not as worried about that $300,000 estimate because that's something that if we pushed into the beginning of next month,
We're a little.
Just a little
we've
bit
got
later.
time on that.
Yeah. So that's really, if I think the 860 should cover us, and that would cover up to $300,000 of medical claims that came in this week. If it's over that, then we'd have to hold the rest for the first of next month.
Okay. All right, we've got a motion and a second. Is there any further discussion? If not, all those in favor say aye. Aye. Any opposed? Ayes have it. All right. Item 7, discussion possible action regarding adding $1 million to general fund reserve watch list for future employee benefit expenses.
I just put that on there just in case, so we'd have it on there, just in case if expenses kept going up, we'd have that on there, just on the watch list, just in case.
When do you think, I feel like we're talking about timing and cash flow a lot here, but when do you think that you'll have a better feel for whether this is a trend versus?
Next month, for sure. Next month we'll know. We could hold off till next month of placing that if you'd like to.
I mean, the watch list is just like
It's
our
just a watch
notes.
list.
Yeah.
We've never denied someone putting something on a watch list. In fact, if anyone knows of anything, I'd like it on the watch list. So
Just in case if everything goes south.
you
and
see what all's on
claims
there.
come in.
There's no way we'd ever pay for it, but I
Right.
just, gosh, to have it down and just
Yeah.
on the radar. I'll make a motion to add $1 million to the watch list for employees benefit.
Is there a second? There is a second. All right, motion and a second. All those in favor say aye.
Aye.
Aye. Any opposed? Ayes have it. All right, I don't think we need item 8. I think item 9 will be sufficient for us here. Discussion possible action regarding a recommendation to transfer an amount not to exceed $71,281 from general fund reserve to the individual departments that are listed in the attachment. This is to cover elected official salary increase as well as 8.5% COLA for those general fund employees that did not receive the full 8.5% in September. I think Micah sent this out to everybody. It's got the numbers of exactly where your department is. If you're needing the amount that's on there or a portion of that amount, that's what we need to know so that we can make the recommendation. I will say, just to kind of start the discussion off, District 1, we've got $6,502 of additional expenses related to this, but we will be able to absorb this in our general fund budget this year. Now, the amount for next year, we'll have to, address that at the budget time, but we had a period of time where we had an employee that wasn't here, so we can handle that. We don't need the extra cash. So, whatever our recommendation is, it would be minus the 6,502.
Yeah, and that's for the county clerk's office. Since we haven't had an elected official in office for this year, we're gonna forego our portions too till next budget year.
Okay, so your fund 160 and 170?
170 and 170, so it's the 3,725 for the elected official, and then the 8,500 on the employees.
Clerk 170. Okay, sorry, 160 was court clerk, so.
Yeah.
Okay. Now, just to be clear, whenever I was talking about District 1, I was just talking about the employee side. The commissioner, District 1, is out of a different account, and that one we'll have to do because it was budgeted very tightly.
I'll hold off on my 130. Just make sure it's budgeted next year.
On the elected official or both
On the employee side.
employee side?
Court clerk, we can absorb everything for the employee and
For both? You have the elected official, yes?
That will need, the treasurer will need the
Yeah.
1,167.
Okay, and on the assessor, what about the 140 account?
I can absorb that.
Andrea, do you know on yours?
In 2 seconds, I'll know.
Okay. All right, so right now we know on the first page, elected official, the county commissioners will need to make the recommendation for the 19,353. The assessor will need to make a recommendation for the 7448. Is that correct, Marcy?
Sure.
Treasurer will need to make a recommendation for the 1167. Court clerk, we do not need to make a recommendation on that. Is that correct?
Yep.
Great. County clerk, the 3725, we do not need on that. We're pending on the sheriff.
We could use it. We could use this. It would be hard for us to absorb with the pay parity, with having to cover half the pay parity out of general fund.
On the elected official or on the employees or both?
Both.
Okay. Okay, so, the last one on the elected official would be the 4457 for the sheriff. We'd be looking at a recommendation for that one. And then over on the employee sheet, the assessor 130 and the assessor 140, we do not need to make a recommendation on. Court clerk 160, we do not need to make a recommendation on. County clerk 170, we do not need to make a recommendation on. Sheriff 518, 4457, we do need to make a recommendation on. District 1, 910, we do not need to make a recommendation on. Okay. And we've got the amount not to exceed. Do we wanna add this up real quick, I guess?
Will it be a combined recommendation for both, or are you wanting to keep them separate?
I'm sorry.
When we make a recommendation or when I show it on the watch list, I want it as two separate recommendations, one for elected salaries and one for the employees.
Yeah, that would probably be good. So, I mean, our dollar amounts are here.
Yeah.
If you're gonna do it like that, and then on, on budget board, it'll list these all out separately. So I think we can just do a motion. Is there any discussion? If not, I think an appropriate motion would be to recommend funding the $19,353 for county commissioner, $74.48 for assessor, $11.67 for treasurer, and $44.57 for sheriff on the elected official side. And then on the employee side, it would be a recommendation of $44.57 for the sheriff.
Is that your motion?
I try not to make motions.
It can be my motion, what Cody's saying.
I'll second.
All right, we got a motion and a second. Is there any further discussion on any of these? And then the right-hand side is the full fiscal year impact, and we'll address that when it comes to budget time. So I appreciate everybody working through this, looking to see what we can do as far as trying to save money here. So anyway, okay, we got a motion and a second. All those in favor say aye.
Aye.
Aye. Any opposed?
I abstain.
Okay. Ayes have it. Item 10, discussion possible action regarding the budget process calendar for FY 23-24. Mike had put a little calendar here for us.
It's coming. We're prepping. Yeah, we'll be sending out the spreadsheets like in a couple of weeks, and then we'll need to have them back by March 10th to do our part, and then we'll have our, we'll go through all the meetings here like we used to do with Danny. Thank you.
I can't believe it's already that time.
I know, right?
Way too
Motion
fast.
to receive budget process calendar.
I'll
But
second.
if we don't approve,
It just,
Well, yeah.
Never happened.
Still, you just won't have a calendar, you'll be surprised.
and we don't need that.
No.
No surprises.
okay. All righty. Well, is there a motion to approve this calendar?
Branding motion, you guys.
Oh, you made a motion? And did we have a second?
Yes.
Sorry, I'm not
You're fine.
completely with it
You're
today.
still, you're still.
You were still.
You're
still
You're still.
Now you're trying to let it die.
Truth be told, I saw this on the agenda. That's why I was asking John about Rebus. Something they need to be.
So we all
over
need
there. All right, all those in favor say aye.
Aye.
Any opposed? Ayes have it. Is there any citizens to participate? Board comments, District 2?
Welcome, ladies.
No, I don't have
Okay, District 3?
Okay.
Clerk?
Thank you.
Treasurer?
Same, welcome Don and thank you. Yeah.
Court clerk? Assessor? Sheriff's rep?
I will say that Rebus was incredibly helpful after our loss in August of 22. They came through the agency, they had multiple on-site meetings with multiple groups. They were incredibly helpful for our agency and continue to be a resource to a lot of our deputies.
Good to know.
And I should have mentioned when he was in here that I've also heard from employees, and others that have had great experiences over there. It's just the timing. And I think it's because so many of our employees and their dependents have had such great luck there that they may just be inundated with a bunch of
Word of mouth.
clientele and, so that may be the issue, but. Welcome, Dawn.
Glad
To
to be
BET.
here. Yeah,
And
good stuff.
It's everybody.
It's gonna get
Just
fun.
Oh, yeah, really, yeah.
So-
She came in just in time.
That's what I hear.
She brings pizza, right? The new one brings.
Oh, donut deal, donuts on
For
me
the
next
first
time.
year.
For the first year.
Hey,
You're worthless.
Fiscal year, the first full fiscal
First
year.
fiscal
you're-
year.
We'll put it in the
And
budget.
dessert pizza.
Dessert, oh, both. You want
We
some
added
cinnamon
that
sticks
last
with
year.
the pizza?
Yeah, dessert pizza.
We did that, didn't we? Forgot about that. All right.
Food on District 3.
Any new business? Seeing none, is there a motion to adjourn?
So moved.
Second.
All those in favor say aye.
Aye.
Thanks, y'all.
Can I ask you something?
Working on that
Mhm.
stuff.
I needed to pull information on one of our fees.